Hi, I'm Holly, and today we'll be discussing hand washing. Hand washing is part of the standard precautions practices, which are used to reduce the spread of infection. Standard precautions are based on the principle that all blood, body fluid, secretions, excretions, except for sweat, non-intact skin, and mucous membranes may contain infectious agents. Standard precautions consist of various practices, including hand hygiene, personal protective equipment, which includes gloves, gown, mask, or eye protection, respiratory hygiene, cough etiquette, and safe injection practices. But for today, we're just going to focus on hand hygiene. Employees can prevent infection by considering how they may be acting as a vehicle for the infectious agents. When an employee believes they have a contagious infection or disease, it is their responsibility to prevent the residents that they are caring for from being exposed. How do we do that? By practicing hand hygiene. Hand hygiene is the easiest and most effective way to prevent the spread of infection. Keeping the body clean, including the hands, helps keep diseases from spreading from person to person. The term hand hygiene includes both washing with soap and water or using an alcohol-based hand sanitizer that does not require the use of water. How do you know when to use soap and water versus the alcohol-based hand sanitizer? You want to use soap and water when your hands are visibly soiled, before preparing food. You want to use soap and water when assisting a resident who has diarrhea or is vomiting. You want to use soap and water after known or suspected exposure to the organism C. diff or norovirus. You also want to use soap and water after using the restroom. When should you provide hand hygiene? You want to provide hand hygiene before having direct contact with a resident's intact skin. You want to perform hand hygiene before putting on gloves, before caring for any invasive devices such as a Foley catheter or feeding tube. You want to perform hand hygiene before handling food and before administering medications. You want to also perform hand hygiene after having contact with a resident's skin, after having contact with any body fluids, even if gloves are worn. You want to wash your hand after having contact with residents' dressings, bandages, any dirty laundry, any trash. You want to wash your hands and perform hand hygiene. You want to perform hand hygiene after taking off your gloves. You want to perform hand hygiene when you're moving from parts of a resident's body that's more contaminated and then you're moving to a clean area. You want to also perform hand hygiene. You want to perform hand hygiene after using a restroom, after coughing, sneezing into your hands, using a tissue, and you also want to perform hand hygiene right after smoking. It's Holly from Exceptional Health Network. I am going to demonstrate the use of a alcohol-based hand sanitizer. You should only use alcohol-based hand sanitizer when your hands are not visibly dirty. So we're going to go ahead by getting our hand sanitizer. We're going to apply a nice amount to the palm of our hands. And when you're using hand sanitizer, the whole process should take about 20 seconds. So you want to do palm to palm first. Interlocking the fingers, the back of the hands, and get your fingers in there, a twisting motion here. You want to get your fingertips and fingernails here good. I'm going to get those thumbs. And you also want to make sure you get the wrist area. And that is going to be how you use alcohol-based hand sanitizer. Thanks for watching. Back for Exceptional Health Network. And today I am going to do an example of proper hand washing technique. So what you want to do when you wash your hands is you want to make sure you turn your water faucet on first. Make sure that the water is warm. You don't want hot water because it can dry the skin out and leave tiny cracks in the skin. So you want to wet your hands. You want to apply a liberal amount of soap to the palm of your hands. And you're going to start out, you want to wash your hands for at least 20 seconds. A lot of people sing the happy birthday song twice. Some people sing the alphabet 2 or 3 times to get to the process to make sure that you have that 20-second mark. So what we'll start doing is do palm first. We're going to interlock the fingers to get between the fingers. On top of the fingers, hands, the other one, we're going to wash our thumbs, the other one, you want to make sure you get your fingertips. Other hand. And you also want to wash around your nails. And then you want to get that wrist area. If you're washing your hands correctly, it will take you longer than 20 seconds. So after you got a good lather, you don't wash all surfaces of your hands and your fingernails. Go ahead and rinse that soap off. And when you rinse your hands off, make sure that the water drains in a downward motion because you want to get all that dirty surfaces off. And you don't want it to run back down your hands. Then you'll grab your paper towel or you use your air dryer to dry. Dry your hands off completely. Get another paper towel. And use that to turn your faucet off. And you are complete with washing your hands. Thanks for watching. I hope you learned something. Goodbye.